Hello everyone, this is Yash Saxena and you're watching SwadeshiVIP. Today in this video, we are going to talk about the prussic acid poisoning in cows. Prussic acid is not normally found in plants, but under certain conditions, several common plants can accumulate significant amount of the cyanogenic acid. Glycosides that can be converted to prussic acid. The prussic acid poisoning in livestock is a possibility, increased during drought periods and even when stressed. Especially after the drought has ended, plants that have been stunted begin to grow. Prussic acid is a powerful, fast acting poison which enters the affected animal's bloodstream and is carried out throughout the body. It then prevents the oxygen consumption by cells, resulting in the asphyxia, kills the animal. Let us understand the signs of poisoning. Signs of poisoning usually occur 15 to 20 minutes after the toxin is consumed. Death occurs very quickly, approximately 2 to 3 minutes after the onset of clinical signs in very serious cases, whereas within 1 to 2 hours in acute cases. Usually, animals are found dead with no signs observed. The brain and heart are the first to be affected by the lack of oxygen, and so the resulting clinical signs prior to death include breathing difficulties, rapid, weak, irregular pulse, anxiety and restlessness followed by depression, stumbling, staggering, muscle tremors, moaning, dilated pupils, recumbency, bloat and sometimes salivation and vomiting, terminal convulsions, bright red mucous membranes, other than signs poisoning. Diagnosis is also very important part when we talk about the disease. A diagnosis of prussic acid poisoning is made on clinical and or postmortem findings and by the recovery of the poison from the plant feed and from the animals. On postmortem examination, it is noticed the blood may also be bright red and clot poorly. The blood will return to a dark color a few hours after the death. Muscles may be dark and there may be hemorrhaging in the trachea and lungs. Hemorrhages will be evident on the surface of the heart. There may also be a smell of bitter almond in the rumen. As we have discussed about the diagnosis and signs, we should also talk about the treatment and prevention methods. Treatment aims to re-establish oxygen transport at the cellular level. Sodium nitrite is injected intravenously to convert hemoglobin to methemoglobin, which reacts with cyanide to form cyanomethaglobin. A simultaneous injection of sodium thiosulfate provides sulfur to convert cyanomethaglobin to non-toxic thiocyanate, which is excreted in the urine. An alternative treatment is to inject a large dose of sodium thiosulfate alone. This is the preferred treatment if there is suspicion that prussic acid poisoning is combined with nitrate poisoning. Treatment will need to be repeated. Animals should be removed from the source of the poison immediately and fed safe feed to help dilute the amount of poison in the rumen or stomach. Animal exposed to the poison source should be treated even if they are not showing any clinical signs. Animals should be handled as quietly as possible. Prevention is better than cure. All of us have heard of this. But how do we prevent our cattle from prussic acid poisoning? First is do not allow stock to graze risky food sources. Have feed analyzed if safety is in doubt. Do not allow stock to graze drought-stressed, immature, wetted or frost-damaged plants that are known as cyanogenic glycoside accumulators. Never allow stock to graze sorghum that is less than 50 cm high. Feed hungry stock with hay before allowing them to graze forages which may contain high levels of cyanogenic glycosides, that is prussic acid. If buying sorghum hay, make sure that it was cut during low risk condition. There is no decrease in prussic acid content in the process of haymaking. Feeding material as silage will reduce the risk of poisoning as correct ensilage for 3 weeks reduces level of toxins by approximately 50%. On feeding out, some toxin will be released as gas. It is still recommended that the feed be tested prior to use. Green chop forage may be safer than the same plant material in a pasture because selective grazing of high risk leaf material is prevented. Linseed gruel should be thoroughly boiled to remove any prussic acid. Supplementation of sulfur, if a deficiency exists, will increase the animal's efficiency and converting prussic acid to non-toxic thiocyanate. So, this was all about the topic. For more information on cattle health and dairy products, keep watching our channel, Swadeshi VIP. This is Yash Saxena signing off.